some folks here. Welcome. Hi, everybody. We're just waiting for 4:15, and we should be starting in 3 minutes. Welcome, everybody, and happy Unity Day. Alexa, can people use the chat?
Yes.
Thank you. Guys, can introduce yourselves, say hi, send a nice message. Hey, it's 4:15, and we're officially on.
Sounds good. Well, while we're still on camera, I think we'll just quickly do introductions. So, welcome everyone. Thank you for joining our session. We're really pleased to be here today and talking to you about community health workers and their involvement in promoting traffic safety. I'm Jamie Burns. I'm a highway safety specialist with the National Highway Traffic Safety Administration, or NHTSA. And so we're going to share some of our resources today with all of you that might be helpful in promoting traffic safety. We'll be focusing on pedestrian safety and school bus safety and child passenger safety as well. And so we recognize community health workers can play a really important role in helping us get our safety messages out into local communities. So just thank you for all the work you're doing and all you're going to do to support safety in the communities. I will pass to my colleague, Bridgett Watson, to do a brief introduction, and then we'll go to Joanna. Thank you.
Thanks, Jamie.
Hi, everybody. Thanks for hanging in there with us. We know it's late in the day, so we appreciate you joining us for our presentation. As Jamie said, my name is Bridgett Watson, Highway Safety Specialist with NHTSA. For those who aren't familiar with NHTSA, it's the National Highway Traffic Safety Administration, and we are a part of the United States Department of Transportation. So joined NHTSA about 1.5 years ago, but prior to joining NHTSA, I worked in injury prevention at the state level in a level 1 trauma hospital doing inpatient injury prevention work, but also out in the community. And so excited to be here and excited to chat with you all. So I will pass it to Joanna.
Hi, everybody. Good afternoon. I'm Joanna. I am a community health worker. I just got promoted to NACHW ambassador. So I am an ambassador for Massachusetts. I am so happy to be here. And today with my colleagues, I will just talk a little bit about the traffic safety and how as community health worker we can be involved. I am a car seat technician. I will be talking a little bit about that. Excited to be here.
All right, great. So I will go ahead and pull up some slides. And if someone can let me know when you see it full screen.
You're good.
Okay, perfect. Well, thanks everyone for joining us. So our session is titled Collaboration with Community Health Workers to Promote Traffic Safety. All of us here on this presentation have experience in the traffic safety world, but also we all have public health backgrounds. Like Bridgett said, she worked in injury prevention. Joanna is a child passenger safety technician. I previously, before I worked for NHTSA, have been doing some county health department work. So really excited to share some resources with you today. So for those who don't know, NHTSA is the National Highway Traffic Safety Administration. It's a federal agency, as Bridgett said, within the Department of Transportation. We're focused on the behavioral side of traffic safety. Our mission is to save lives, prevent injuries, and reduce economic costs due to road traffic crashes through education, research, safety standards, and enforcement activities. This includes individuals inside and outside of the vehicle. And while we're known for our 5-star ratings and vehicle regulations, we're also responsible for developing, implementing, and supporting programs and efforts that address driver and non-occupant safety. So that may include safety belt use, stopping impaired driving, and improving safety for people who walk, bike, and roll. So specifically, Bridgett and I both work for the Safety Countermeasures Division. This is within the Office of Safety Programs. We cover an extensive range of behavioral safety program areas, and you'll see those presented here on this slide. So that includes pupil transportation or school buses, pedestrians, bicyclists, older road users, motorcyclists, micromobility users. So that might include e-scooters, e-bikes, and all these different emerging technologies and other transportation options that we're seeing on sidewalks and roads. Rail grade safety, so train tracks, public health, and tribal communities. So based on our latest available data, vulnerable road users account for 50% of all motor vehicle traffic fatalities. Within our safety countermeasures division, our primary purpose is really twofold. We're hoping to research, develop, and test safety countermeasures specific to policy, programs, traffic safety trainings, or other strategies, and then determine the effectiveness of those. And then what we do with that work is we turn it over to our regional offices and state partners and other outside safety partners to advocate the use of those materials and resources. We also help to provide technical assistance to reduce injury and death to the vulnerable road user categories listed here on the slide. So I'd like to ask all of you a quick polling question. So if you don't mind responding in the chat what you think the answer is. So we have for 2022 on average, no more than 100 people were killed each day in the US traffic crashes. And Bridget, if you don't mind just checking the chat for me and letting me know what the majority response is.
Looks like we have a lot of falses coming in. Yep.
Okay.
False.
Awesome. So just wanted to cover our data for you. So you are correct in saying false. It is actually 116 people on average, and this is just data from the year of 2022, which is our most recent crash data to date. We want to recognize that traffic injuries and fatalities are a public health crisis. They do affect all road users, and that 42,514 fatalities occurred on US roads, and then 6,528 were injured every day. And like I said, this is 2022 data. So we just want to take a moment again to thank you all for joining us and the important work that you're doing as community health workers. We're a federal agency, and so we're quite removed from the local level communities where the work really happens. And so we just thank you for your efforts and all you're doing to make your community safer and to promote traffic safety. Cannot thank you enough. That's where a lot of the real work happens, and so we greatly appreciate it. Just briefly, we're going to talk about pedestrian safety data, Pedestrian Safety Month campaign. Then Bridget will talk about our school bus safety data and programs, and then the School Bus Safety Week. And last but not least, Joanna will cover her community health worker collaboration specific to the child passenger safety in her community. So the first resource I want to share is an interactive data visualization tool that focuses on several highway safety topics of interest. It also includes multiple dashboards with information on motor vehicle traffic crash fatalities. This uses the NHTSA FARS data, or Fatality Analysis Reporting System. And I just want to say that in order to be included into the FARS data set, a crash must involve a motor vehicle traveling on a public traffic way, and it must result within the death of a vehicle occupant or non-occupant within 30 days of that crash. And so we do have data dashboards available in all of these programs listed on the screen. So just to give you an idea of the type of data that you're able to pull from this data set, here's one specific to pedestrian safety. And so we know that for many people, walking is a primary means of transportation. It maybe is because a person cannot afford other options, they don't have access to them, or they're restricted from using other forms of transportation. So this data set pulls from 2013 to 2022. And unfortunately, what we're seeing is that pedestrian fatalities are increasing. And so they are 7,522 pedestrians were killed in 2022. This comprises about 18% of all traffic fatalities that we're seeing for that year. And also 67,000 pedestrians were injured in that same year. So we also recognize disparities do exist for pedestrian fatalities. From studies and research, we're seeing that Native Americans or Alaskan Natives are about 7 times more likely to be killed as a pedestrian, and African American pedestrians are about 3.5 more times to be killed. So many of you work in different states, and so you might be wondering where your state lies with that local data. So I did want to show that we do have geographical options where you can pull by region, state, county, or even city to get some specific pedestrian fatality data at those various levels if you're looking for that. So just wanted to highlight that option. And then some national trends that we're seeing are that the highest contributing factors for pedestrian fatalities are nighttime. So environmental conditions such as lighting and weather contributing to a lower visibility. Also, pedestrian fatalities happening at non-intersections might be locations where there's no traffic control device, no crosswalk, no marked lanes, no signal lights, and mid-block crossings. So really emphasizing the environment that might not support or present a safe option to cross. Also impairment. So about half of all fatal pedestrian crashes in 2022 involved alcohol use by either the driver and or the pedestrian. And then nearly 1 out of 4 pedestrians were killed in crashes that were struck by hit and run drivers. So some other common factors surrounding these hit and run crashes include poor lighting conditions, early morning time frame, and occurrence on the weekend. And lastly, we're seeing a big influence with speed. So pedestrians are particularly vulnerable to severe injury and fatality when struck by high-speed vehicles, and even slight reductions in vehicle speed can result in significantly fewer and less severe pedestrian crashes. So lower speeds help also to reduce the societal and individual costs of crashes and the burden on post-crash care or emergency response. So here's another breakdown using that data visualization tool, so you can just see some of the similar data sets that I'm pulling from that. About 50% of pedestrian fatalities occurred from 6 p.m. To 11:59 p.m. We're seeing more pedestrian fatalities in the fall and winter when the daylight hours are less. And then some of these other categories illustrate the other data sets that I just mentioned. Here is one of our infographics that we have available on our traffic safety marketing webpage. We'll provide that link in a few slides forward, but really overall just illustrating that as speed increases, the risk of death increases. And another disclaimer I wanted to add is that these risks do vary significantly by the age of the pedestrian. So for example, the average risk of severe injury and death for a 70-year-old pedestrian struck by a car traveling at 25 miles per hour is similar to the risk of a 30-year-old pedestrian struck at 35 miles per hour. So it does get more severe as a person ages due to frailty that happens with the aging process. So our national strategy, the National Roadway Safety Strategy, describes major actions the Department of Transportation is taking to make a meaningful difference. And at the core of this is our safe system approach. This is a human-centered design that states death and serious injury are unacceptable. It recognizes that people are vulnerable and prone to error, and we need to mitigate this with a transportation system that protects against this vulnerability. This is a shared responsibility, whether you use, design, or build the transportation system. So walking through the different objectives of the safe system approach, first we have safer people. This is encouraging responsible behavior by people who use the roads and to create conditions that prioritize their ability to reach their destination unharmed. Safer vehicles focuses on safer vehicle design and features that help prevent crashes and minimize the impact on both occupants and non-occupants outside the vehicle. Safer speed promotes safer speeds by a combination of thoughtful, targeted, and context-appropriate outreach campaigns and enforcement. Safer roads facilitates safe travel by designing roadway environments that accommodate human mistakes and injury tolerances. And lastly, post-crash care focuses on survivability of in crashes with efficient access to emergency medical care, and also to create a safe working environment for vital first responders to prevent any secondary crashes that might occur. So at NHTSA, we work to develop some countermeasure strategies that can be implemented to prevent some of these tragedies and decrease the severity. So we recognize that while fatalities among all road users have increased, we recognize that among pedestrians, it's increased even faster. NHTSA has published countermeasures that work, which uses a 5-star rating system to rank countermeasures demonstrated to be affected by several high-quality evaluations with consistent results. So I've listed various strategies broken down by the safe system components here. So for example, the first one would be a high visibility enforcement of driver compliance with pedestrian right-of-way laws. So this would be a combined effort with law enforcement and communication strategies, as well as public outreach and communication. Might include increased signage or marketing that would ultimately increase yielding to pedestrians at a crosswalk site. And then, of course, for safer speeds, the first and foremost would be to lower speed limits. As we've previously discussed, when a vehicle's traveling slower, it's less likely that it will cause a severe injury or death. And then also the implementation of automated speed enforcement. So we're seeing speed reductions resulted from fixed speed cameras. Safer roads that have pedestrian safety zones that increases cost effectiveness by targeting education and enforcement and engineering strategies, in particular geographic areas where we're seeing a significant portion of pedestrian crashes. And then lastly, for post-crash care, we can promote the bystander care program. In many instances, a bystander can be the care before care arrives by stopping, calling for help, and staying until EMS is present. And the quicker that we can get emergency response, the better overall results for the injured at a crash. We have some additional resources, including NHTSA's uniform guidelines. We also have a state program assessment process for many program areas, including pedestrian and bicyclist safety. This includes a panel of subject matter experts that can provide some expertise specific to a particular program area in program management, equity and accessibility, education, data evaluation, EMS enforcement, and engineering for the pedestrian bicyclists to provide some new ideas for a state to implement. And NHTSA grant funds, I will say, are awarded on an annual basis, but they go out through the regional offices to state highway safety offices through the submission of an annual grant application. And so we've provided some links that if you don't know who your contacts are for NHTSA regional offices or state highway safety offices, we encourage you to find out who those individuals are so that if you have a project in mind, you might be able to have access to NHTSA funding. These are some newer resources that we've published. NHTSA recently released the low-cost pedestrian safety zone guide, countermeasure selection resource, and associated 8-step handbook. It describes the availability of lower cost and quicker to implement strategies for communities to address pedestrian safety problems in areas that can prevent and reduce the severity of pedestrian crashes. And it also offers quicker solutions to traditionally underserved areas. We also have the comparative study of communities with high rates of pedestrian injuries. And here we've identified common strategies that were successful in communities at improving pedestrian safety. And so coming up in just a few months, October is our National Pedestrian Safety Month. This will be the 4th year since we've launched this as a national campaign. Our vision is that all people in all places should be able to reach their destination safely and easily by walking or rolling. And so we have selected October as the National Pedestrian Safety Month. This is a time when children have headed back to school. There's increased activity as people prepare for holidays, and the days are getting shorter and darker, making it more difficult to see people out walking, biking, and rolling. So we're prioritizing pedestrian safety and raising awareness around that. Campaign materials can equip local governments, organizations, and other partners to address human behavior such as speeding and distracted driving, as well as structural needs that a community might require, such as poor roadway design, so improving that and getting enhanced lighting. Promotes a collective effort and emphasizes the importance of that safe system approach that is incorporated into our national roadway safety strategy. So new materials that are coming out this year, you can see on the left there, we'll have a pedestrian safety community resource guide that will focus on coalition building around pedestrian safety to really make those changes at a local level. And then also we will be launching a new social media playbook. So those have not been published yet, but once they are finalized, they will be available on our traffic safety marketing website. So the link is there. And now I'm going to wrap up and pass it over to Bridgett. Thanks everyone for your attention.
Thanks, Jamie. All right, let me do the fun part, which is making sure that I'm sharing. Let's see. All right. Let me know, Jamie, if I'm sharing.
Yep, it's now full screen. You're good to go.
Perfect. Awesome. All right. Thanks, guys. So yeah, as Jamie said, we're going to move on to our next topic area, which is my area of expertise within our division, which is pupil transportation safety or school bus safety. This area is interesting for me to chat about because we're very lucky in that school bus safety is still relatively great in our across the US. So school bus still remains one of the safest ways for students to get to school. So my presentation is going to focus a little bit more on programs that we have already come out with or programs that are coming that you can easily take out into the community and help spread the message and spread the education around safety around the school bus and illegal passing of school buses. But before I get into that, I want to mention just briefly about our National Roadway Safety Strategy, which is the U.S. Department of Transportation's safety strategy, and it outlines the department's comprehensive approach to significantly reducing serious injuries and deaths on our nation's highways, roads, and streets. This is one of the first steps in working towards the very ambitious goal that we have, which is a long-term goal of reaching 0 roadway fatalities across the U.S. So this is a great way for partners and stakeholders from all levels. That includes government, industry, nonprofit, advocacy, community health workers, researchers, and the public in general to embrace and to commit to that specific action to improve safety on our roadways. You can check out the NRSS website to see how you can make the pledge. I think I tried to put that in the chat before I started, which is our Allies in Action link. And that is a great way for you all to pledge the work in that area. And as I mentioned at the beginning, I worked before starting with DOT, I worked in the community around injury prevention. And before I studied more around transportation safety, I honestly did not realize how much my work in injury prevention was around transportation safety. I just did not make that connection. But for anybody that is working in that space or doing injury prevention, or you're in the community working with your local health department, your hospital, it can be things that we don't think about. So of course, we know that child passenger safety fits into that transportation space. But I was going out into the schools and the communities talking about pedestrian safety, and I wasn't even realizing it when I was talking about distracted walking or going into schools and, trying to talk about distracted, trying to get our kids to not text and walk when they were going to and from school. you know, doing bicycle rodeo events or bicycle helmet fitting events, you know, that was transportation related. When we did teen driving, obviously, that was transportation safety. In my community here, I'm based in South Carolina. We have lots of neighborhoods that use golf carts as modes of transportation. And so, you know, I was out here doing a lot of advocacy work, not even realizing how frequently I was touching transportation. So if you're interested, if you know that your agency or what you're doing on a regular basis is touching on this, or you have the desire to do more around transportation, it's really quick and easy way to get your name on this list of allies in action, and it represents your state. So when you fill it out, your agency, your state, you know, whoever you're working with will go on that list. So it's a really good way to start that. So getting into my area, which is school buses, again, just going to give a brief background on the current state of school buses on U.S. roadways. So when we're talking about students transporting to and from school every day, we, as of last year's school year, the 22-23 school year, there were about 547,000 school buses transporting students on our roads every day. And they were transporting up to 20.5 million students each day. So that is a lot of miles traveled every day, and lots of students being transported every day. And I just want you to keep those numbers in mind for the next slide when we talk about data. It will really show the great job that we're doing in terms of keeping kids safe on school buses. So again, we have about 20.5 million students being transported every day. The yellow school bus is still the most regulated vehicle on the road. That is why it remains one of the safest. Students are still much safer when we're talking about vehicle miles traveled per day, riding a yellow school bus versus being transported in personal cars. So it is still one of the safest ways for students to get to and from school. When we're talking about injuries or fatalities around school buses, the greatest threat to a student currently tends to happen outside of the school bus. So that tends to happen in what we call the danger zone, which is illustrated here in this picture. It is the 10 feet area around the school bus. And then, of course, if a student has to cross the road when they're loading or unloading the school bus. So that is what we call the danger zone. And that danger zone can be different in every state in terms of if that state highway department you know, has increased that. So I know like New York, I think, uses 15 feet as their danger zone. So it can vary. So just in case you come across things in your state and you're like, wait, I thought that girl from NHTSA said it was 10 feet. It can vary, but 10 feet is the average. That is the minimum that we want children to be as close to the bus. We don't want them any closer than 10 feet in that area around the bus. And again, the reason that this is the greatest threat to them is because of the increased prevalence of illegal passing of stop school buses, which is what I'm really going to focus on. It is illegal in all states to pass a stop school bus, which has its stop arm activated. So if you're familiar, if you've driven around a bus, you know that typically a bus will give you a warning. They will turn on their amber lights, and that means slow to stop. So what we are seeing some on the roads is, depending on the risky behavior of the motorists, sometimes motorists see those yellow caution lights and they think, I need to hurry up and get past this bus because I don't want to get stopped behind it. But the yellow amber lights flashing tend to give a little bit of a warning that the bus is coming to a stop within 200 to 300 feet. But once those red lights are activated and the stop arm is out, it is illegal to pass that school bus, because we know that there are going to be children either boarding or unloading from that bus. So NACHWs, which is one of our partners, there are several different partners that work in the pupil transportation space. They are the National Association of State Directors of Pupil Transportation. They do a survey every year that is kind of like a one-day snapshot. So it's not scientific in nature. It's just trying to give a brief snapshot of kind of what is happening in terms of illegal passing on the road. So this year, this one-day survey took place in about 35 states throughout the country, including District of Columbia, and about 26.4% of the nation's school bus drivers participated in this one-day survey, in which they reported motorists who passed their school bus. So in the survey, there was about 98,000 school bus drivers that reported that 66,322 vehicles passed their school bus illegally on that single day during the 2023-2024 school year. So if you adjust that for 100% of the school buses, or the 100% of the school bus drivers in the US, then we would have likely seen on average somewhere around 251,000 illegal passings. And if you project that again across the whole 180-day school year, it would be an estimate. I just want to be real strong in that because it is a one-day estimate, that we may be seeing somewhere close to 43.5 million illegal passings of school buses a year. So that is alarming, and it is increasing. So when we're talking about the data, again, I want to remind that we are transporting around 20.5 million students a day. So when we look at the data, this first data point, again, is a 22-year figure. So it's a very broad time frame when we're talking about averages. But in those 22 years, there were 55 fatalities and crashes that involved a driver illegally passing a stopped school bus. So it's an average of 2.4 fatalities a year. And again, half of those fatalities were pedestrians, 18 years and younger. So again, it's a 22-year span. It kind of gives that brief snapshot, but I would say in the last several years, we have started to see an increase in this. But still, again, those are data numbers. We will never be happy with the data until it's at zero. But for the most part, you can see that pupil transportation is still by far a safe way for students to get to and from school. So again, from 2013 to 2022, there were 976 fatal school transportation related crashes and around 1,082 people of all ages that were killed in those crashes. So that's an average of 108 fatalities per year. And the reason that we say all ages when we're looking at this data is because it also includes injuries or fatalities of the motorist in the other vehicles that may come into contact with the school bus. So if it's a school bus versus car crash and the driver or passenger of the other car is killed in that crash, they are counted in the pupil transportation related crashes. So just wanted to give that disclaimer. Again, from 2013 to 2022, there were 1.5 times more fatalities, again, among our pedestrians than occupants of school buses. So there was 169 fatalities of pedestrians versus the 111 occupants of school buses and related to those crashes. There was a total of 198 school-age children, 18 and younger, who died in school bus related crashes during that period, either again as occupants of the school bus, other vehicles, or on foot or bike. Of the 198 school age related deaths, again, 76 of those were children who were walking. So over 55% of school age pedestrians killed in school transportation related crashes were between the ages of 5 and 10 years old. And for this data set for this past year, this was just released, more school-age pedestrians were killed from 3 to 3:59 p.m. than any other hours. And I made a note to this because typically and historically up until this year, this tends to trend at 6 a.m. to 6:59 p.m. or 6 a.m. to 6:59 a.m. And we contribute that to the poor lighting in a lot of areas during that hour. We had we had kind of a an outlier this year data wise that kind of tipped to the 359, which again is drop off. So we know that that's why that picked up, because that tends to be the drop off time at the end of the school year. But just know that historically it tends to trend more during that morning hour, the 6 to 6:59 a.m. Due to the poor lighting. So what are we doing in our office around school bus safety? I'm sure many on this call have heard either in the news or in the newspaper about the bipartisan infrastructure law. That was a law that was passed several years ago that provided a lot of funding to the Department of Transportation to do work in different areas that were called out by Congress. Pupil transportation was heavily called out in the bipartisan infrastructure law updates. So we have been working on these several areas due to congressional mandates and those additional fundings that were provided to us. So the areas that we were required to touch on to the bipartisan infrastructure law was a legal passing public messaging campaign, which we did complete in 2022. And even though congressionally we were only required to do an illegal passing public messaging campaign 1 year, our division has felt, and our leadership at our division has felt very strongly about it. So we have continued that by funding that for a second, third, and going on a fourth year around public messaging campaigns around illegal passing. We're mandated to do a review of different technologies that will help mitigate illegal passing. So that's different technologies that can be on the school bus that can really help mitigate that illegal passing, whether that's stop arm cameras, additional lighting, alerts, etc. We were required to do a review of driver education materials to see how often illegal passing or just school bus education in general was being provided to driver education, and that includes new drivers, so teen drivers, but also first-time drivers. There are a lot of adults throughout the U.S. who are first-time drivers after the age of 18. So we looked at both sets of that. We had to do a comprehensive state laws report on illegal passing, and we're doing the relationship between illegal passing and other safety issues that are specific to rural areas. So getting into some of the programming, and again, I'm not covering all of them because I think we're working on about 12 different areas of pupil transportation, which is great. I just wanted to take some time to call out the ones that I think would be most useful to this group. So we launched in 2023, in October of 2023, the Pupil Transportation Toolkit, which is planning safer school bus stops and routes. So this is an online interactive toolkit that is live now that helps promote best practices for communities that are planning school bus routes to make sure that they're doing them in a safe way, that they're taking into consideration if they're urban, rural, suburban, or if they're in underserved communities. And it, again, is interactive, and it allows them to put in information and populate the best practice for that specific area. So if you're working with schools, if you're working with any agencies that you know that are doing this type of planning, or if you just want to help get the word out to your community that this does exist, especially through our pupil transportation directors within the school community, you can help pass this information along to those professionals. And then this should be coming out any day. It is in our agency review, which means it's not published yet. However, it should be coming out very soon. And this will be really great for our communities. That is the Illegal Passing of School Buses Study and State Laws Report. So this is going to be a comprehensive look at every single law within the U.S. and what it says around illegal passing. Every state has different laws. Every state has different stipulations. If you're approaching a bus on a 4-lane undivided highway, or if you're approaching a bus on a 4-lane non-divided highway, what do you as a motorist do? And so this is going to be a really comprehensive report that will not only help educate the community, but it's going to help us internally also as we build out future projects. So this will be a really resourceful report that you can use, or that you can at least help pass along to the people that are doing school bus safety in your community. And then this is the driver education project that we just finished up at the end of this month. So it should be coming out in the next couple of months. Excited about this one as well. It's the Enhancing Pupil Transportation Safety and Driver's Education. So again, we did the review of all driver education materials across the US. We found the gaps that were in that. And then to supplement that, we have created 2 standalone additional modules that schools, private driving schools, again, public schools that have driver education programs, anyone that is doing additional education around young drivers, or again, those first-time drivers, will have access to these 2 free modules that will be specific to pupil transportation safety, and again, just supplemental situational safety. So the other module not only just has pupil transportation related information for students, but also aggressive driving, what to do around aggressive drivers, weather, rule. It has a lot of different aspects to it that again are standalone. They're going to be super simple to use. They'll be in a PowerPoint format with a trainer guide that will come with it. So you should be able to go to our website, grab those off, take it to a class, and present it. So we wanted to make it as easy as possible to get this information out to our community. And then again, this is one of our other projects, which is the development of pupil transportation educational materials for school. This is a big project, so it's 5 years long. So we've got a couple of years before this is coming out. And the reason that this project is taking so long is because we are doing a full K-12 curriculum around school bus safety. So this will include lesson plans, videos, take-home materials, you know, the whole shebang. So that a school or a community, it doesn't have to be a school, but any community can go onto our website and they'll be able to pull off, okay, well, I'm going to a health fair that's going to be focused on ages 5 through 10. I want to go into this curriculum toolkit that they have on NHTSA.gov, and I want to pull off signs and signals. So I want to take 15 minutes to teach these K through 3 third graders to help them learn what the different signs and signals are that they might come across the road. So it's not just going to focus just on school bus safety. It's going to focus on transportation safety as a whole, teaching children, again, starting in kindergarten all the way up through 12th grade. So, our middle school is going to be, definitely more tailored to middle schoolers. The videos are going to be less than a minute, and there's going to be a lot of them. So we know that our attention spans are getting shorter even for us adults. So, we're keeping in mind the learning styles of all children who will be taking part in this. So we're excited about this. I wanted to include it, even though we still have until fall of 2026 before it'll be out, just because when this does come out, we're going to be doing a big push for it, and just really hoping to get this out, because that is a gap that we have discovered, is that there's not really a full curriculum around school bus safety for students and parents and caregivers to learn about. And then again, we are working on a rural project that is focused on rural communities around pupil transportation and pedestrian safety. This was actually a gap that was identified by our regions within NHTSA, that we really had a gap in information around rural communities. So this project is really going to focus on specifically the safety and the terrain, the hazards, et cetera, that rural communities face. And this is obviously important to many of us on the call. I know myself, I'm in a rural area, so super excited about this. This is a 3-year project that kicked off in 2022. It'll be similar to the project that I just talked about prior. It'll have school-related and public health related information for agencies to use. And then we
Hey,
have
Bridget.
Yes.
Sorry, I hate to interrupt you. I want to stop you. We have a lot of
Yes.
NHTSA projects to share, but just for
Oh,
sake
yeah.
of time, I want to make sure that Joanna has time to share her
Perfect.
options. So let's just pause
Yes.
here for now.
Yeah.
And Joanna, if you don't mind jumping in, because I see the chat as well, and people are asking about how community health workers
Perfect.
link to this. So we're going to pass it, and if we have additional time, we can always circle back.
Yeah,
Thank you.
no
Thanks,
problem.
Bridget. Great job.
Okay, I am gonna share. Let me know which one you see. If I should switch.
Yep. It's not full screen quite yet, Joanna.
How about now?
And now just switch the settings because we're seeing your notes.
Okay.
There you go.
Better?
Perfect. Yes.
Great, great. Of course. Hi, everybody. I know that it was a lot of information, right? We got a lot of info, a lot of statistic data that shows that the safety, the traffic safety is an issue. And I'm gonna talk about what I do in this area, and I'm just gonna open the door for us all to see how we can jump to this opportunity and do more than what we traditionally do. So I'm just gonna move some stuff around so I can talk. Okay. As I said before, my name is Joanna. I am a community health worker. I have been a community health worker majority of my adult life, and I am very blessed to be here today. I work for the New Bedford Health Department here in Massachusetts, and we're just gonna talk a little bit about community health work and safety, traffic safety. How did we get involved? Somebody just asked on the chat, oh, great information, but how does community health worker get involved in this? So here in the city where I live and I serve, we used to do car seats long time ago. We used to do car seats before the pandemic. And then because of the pandemic, of course, we had to stop everything. In 2023, we heard about this program, the state was doing for car seat distribution program. So we said, oh, great. So we applied for the grant and we got denied. We got denied. We asked like, why, how come? Like we need it. And they explained to us in order for us to have car seats, we had to have car seat technicians. Okay, great. So we decided to go ahead and put a plan so we can get car seat technicians. And here inside our department, we had to go to a little meeting and we'll decide who should be the car seat technicians. Of course, it had to be us because we are community health workers. We do everything. People knows us. People trust us. So, and after having some meetings around the community, we realized too that a lot of people, police department told us that a lot of people usually they inquire for car seat technicians for car seat installation, but they cannot do everybody, so they will send people away. Then we decided, okay, let's do it. And that's how I got involved. This is just a little ideas. I'm not going to talk about, because I know we've been talking a lot today. I have a PowerPoint presentation, but I'm just this is just ideas or tips to how to install a car seat. But I don't think this is the most important thing for our audience today. I can send this information through email, but I'm just going to jump to why it's important. I'm going to ask you guys to please answer this question for me on the chat. What is the appropriate age for children to stop using a car seat or booster seat? Do we think it's 4, 7, 10? What should be the age? What would we think is the age? Jamie, Bridget, please let me know.
Yes, so first I'm getting, there's 4, there's 10, none of the above.
Great. Who answered none of the above? Alexa, can we unmute someone?
None of the above, and they're saying it's the height.
Good job. Exactly. Car seat, it doesn't go by age. And I, long time ago, used to think there was, for me, to be honest, when I arrived here in the United States, car seat was new to me. I had to learn. So when my kids were born here, and every time I asked the doctor, so can he go to a seat? Can he just go to a seat? No, he needs to meet the requirement. That's how I learned. But a lot of us don't have the opportunity to learn. So children should stay in a booster seat until they're about 57 inches, or the seat belt fits proper. Because that's another thing. It's not just because, oh, he's 12 years old, he's 13 years old. But if he's a tiny kid, the seat belt is not going to fit right. So he still needs the booster. And I live in a city where almost everybody that I know, let's say, or everybody that I serve, are people that were born outside of the United States. People that doesn't speak English, people that were not privileged like we are. People that are coming from the rural areas, people that are coming from low income countries, or just people just like us, immigrants, just like me. So I'm going to explain why I think it's important for us community health workers to do the work that I do. So now I'm going to introduce myself. Before I was just kidding. Now I'm going to introduce myself. So I was born and raised outside of the United States. I moved here as a grown up. I was 22 years old when I moved here. It was hard to learn how to navigate the system, how to get to places, how to learn the language. And when you move from another country to United States, it's not only the language that you're learning everything, because you learn how the system works here. In my country, it was, I get sick, I go to the doctor, I go to the emergency room, that's it. It's no preventive care, it's no PCP. That was luxury that I learned here. So I'm sure so many people still arrive into US today with the same understanding as me. So that is why I jump in what I do for my community. So understanding and navigating the system is challenge for people whose first language is not English or just coming from another country. And who better than us community health workers to serve and to help with this problem? So I do a lot of things, and every chance that I have, either if I'm helping somebody with health insurance, or I'm helping people connecting to service, because I don't have that direct patient experience. Like I don't work with one people, I work with the community. My job is to make sure that the whole community has the same access, or has the access that they need to achieve the better care. So every time I have somebody in front of me, what I do is I make sure I ask them questions. Is this the way I am? Is this how I do? And one of the questions that I usually ask is, oh, I see that you have kids. Do you have a car seat for her or for him? And the questions I got usually is, the answers I get is usually is, no, he's walking already. He doesn't need car seat. Oh no, she's 3 years old. She doesn't need car seat. No, we don't have a car seat. Why? Why do we need a car seat? So then I take my time to explain and to educate why we need a car seat, because here the rules are a little bit different. And this is how I think we can jump as a community health worker and help, because we already connecting them with the resources, with the system. So why can we just do everything all together? And the reason why we can do it is because we speak the language that they speak. We have the same life experience. We look alike, right? We share the same culture. So it's much easier for somebody that looks like me to come to me and explain, hey, Joanna, let me tell you something. Here in the US, we do this, and that. Then somebody that I don't know, that doesn't speak my language, doesn't look like me, coming and explaining to me. So, and I do this, guys, believe me, it brings me a joy. A lot of people say you work for money. Of course, you work for money because you have to pay your bills. But the satisfaction that I get when a family, when somebody tells me, "My goodness, thank you for opening my eyes. Thank you for telling me I could get in trouble with cops or something like that." Money doesn't pay that. So that's why I feel it's so important for us to be doing this. Now I'm gonna tell you a little bit more. The reason I have all the certifications that you guys see on the screen is because one of my roles here at the health department is to go out in the community to meet people. I do focus group. I do a lot of things. As you see here, I am fluent in 4 languages, so it's easy for me to communicate with a lot of people. And when I talk to them, I usually ask about everything. I always take in consideration the social determinants of health, because housing is health, transportation is health, insurance is health, school is health. So I ask all of this. And the questions, a lot of people after actually I did this presentation before with Jamie on one of the NACHWs meeting, somebody asked me, "Oh, I know that you do car seat installation, but how about the schools on the kids on the school bus? Who takes care of that? How do we know that the kids are safe?" And I was, hold on a second, I will have an answer for you. And I came here at the health department, started talking to my colleague, and she said, "I think that's a great idea. I think we should get into that. We should understand more so we can educate more." So that is something actually right now we're doing. We're learning a little bit more about that so we can educate. That is something that somebody else, somebody that is on this call can take upon themselves and get their education, get their training, and start helping people that way, start serving people that way. And another reason I share this screen is just to show them to be a community health worker, you don't have to necessarily work in the clinic on a health side or on the health settings. You can, any of this is health, any of this is community, any of the certifications that you see here, they all link me back to community health worker. So car seat is a need. Child safety is a need. So that's why I decided, and thank you so very much, Jamie, for inviting me to come here to talk to you guys, to understand, and to give you this chance for all of us to just jump in and start doing a little bit of education around car seats and child safety. I have more on my slide, but I'm not going to present the slide. I think we have talked a lot today. I'm just going to pause here. I'm going to stop sharing my screen, and we're just going to open the floor for questions.
And I did want to add that anyone should be able to unmute. So if anyone does want to just unmute their mic and ask a question, we have that option as well.
I know it's 5:15, but I'm sure we still have a little bit more in us.
Hi, this is Adrienne Proler. I'm a community health worker in Atlanta, Georgia. And I wanted to talk to you about policy advocacy. So, Joanna, what you're doing is on the local level, and Bridgett, what you're doing is national, right, federal. But it seems so in my neighborhood, we've done some advocacy work for sidewalk safety. I'm active in the pedestrian urban planning movement here in Georgia, and I guess a lot of times what we get from the city when we go to the city about sidewalk safety or pedestrian safety or lack of crosswalks or traffic signals, even the flashing lights for school safety zones. We get finger pointing for it's So it's not, the city will say, no, this is a state road, so you need to go to the state, or they'll say, no, it's a federal road, and so you need to go to the federal government. So there's a lot of, so I'd like to get your opinions about best ways to advocate, especially, so my community is underserved, and 33% of the people in my neighborhood do not have a car. So pedestrian and bicycle safety is especially important in an urban underserved community. Can you just give me some thoughts on that?
Yes, so I can jump in first, and Joanna and Bridget, please add to the conversation. So really, on a national, federal level, we're trying to advocate for the safe system approach, which is, that 5-point structure: safer people, safer vehicles, safer roads, safer post-crash care, and all of that. So essentially, yes, we first of all want to recognize and normalize that the amount of people that utilize either walking or bicycling, that mode of transportation, first bringing that to the forefront, I think is very important to show that there are a lot of people using it, which you have done by saying that 33%, in the neighborhood don't even own a car. So it'd be important to message around that, saying that they are utilizing that transportation. It is a main mode for them. And then also, we really do want to emphasize, it's kind of unfortunate because nationally, the data we primarily use is the injury and crash data and fatality data. And, the whole goal of public health is we want to prevent all of that from ever happening. And so it is somewhat of a backwards approach, but if we do have those data points, sometimes, unfortunately, that is what it takes to really illustrate and tell the story. What I would see as a community health worker role is that storytelling and sharing. If you know the individuals that live in your community, you know how they're affected. You know how they travel, you know what challenges they faced. So I would see, as a community health worker, and Joanna, please join in, is just the advocacy of sharing those stories, and elevating that message into how it's truly impacting the community at large, and what needs to be done. But Joanna, I would like to defer for you because of you have a direct connection to this.
Oh, definitely. I think what you just said, Jamie, it's the key, storytelling. Because if you have one story, have two or three, you have the families on your side. You go to the city council hearing. That usually happens once a month, I believe. And you just bring those stories. People hear today, people hear tomorrow. And believe me, they have great impact. I know because I know stories that I have said in settings that has gone around nationally. So stories do are strong and they're powerful. So I think one of the ways to do is that get the families on your side and request a city council hearing.
Thank you.
Of course. Come on, guys, don't be shy.
Great question.
here.
And I do see one in the chat, Joanna. So it says the car seat is the lead-in. How do you find out what other needs the individual or family might have? So I think you could speak to that, Joanna, because you're public health department. So people may be going there for other resources in addition to car seat safety.
Okay. Of course. I'm gonna tell you a story. Stories are powerful. The other day I was tabling on for an outreach event, family back to school, and I saw at least 5 pregnant women, people that I know, people from my community that I know either just came to the country or people with low income. And we have 2 choices. We can, if they have mass health standard, if they have Medicare, Usually Medicaid gives them the car seat for free, and we do install. If they don't, or if they don't qualify for some reason, we just give it to them. But every chance that I have, I run. I have my card, my business card, everywhere that I go. I was on the table, my colleague looked at me, she goes, okay, I know you can go. Because I was chasing those girls. I was chasing those moms. I was chasing them. Excuse me. My name is Joanna. I work for the Board of Health, and I see that you're pregnant. Are you ready? You have a car seat? Oh, no, I'm waiting. Actually, I'm going to wait for my baby shower. Maybe somebody will give it to me. I go, okay. How about you connect with me back in the office tomorrow? We can talk a little bit more. And then that's a chance to talk to those people to understand if they qualify, don't qualify, or if they need it. Another way is here we do a lot of service. I do mass health enrollment. I'll do insurance enrollment. Usually when people come to an appointment, they come with kids. I go to the school usually a couple times a month to meet with parents. They have a parent cafe, and every time I go, I leave my information, all the free service that we have. So we have a lot of referrals. People call us. And then the word of mouth. If you serve one family today, believe me, they're telling their families, they're telling their friends. So like this week, tomorrow I have 2 car seat installation. On Monday I have 3, and this is all from word of mouth.
Thanks, Joanna. And I'll just add in too that a lot of the resources we've shared for the federal NHTSA level, we're hoping that those are useful to you. And I would also just encourage you that if you're finding they're not meeting the need of what your community might need, please let us know. I'm going to put our contact information in the chat, but we're always looking for new ideas on any communications materials you might need, toolkits, resources. We'd love to get that information out from all of you so we can tailor that request and make sure that it's useful for you all. So.
I'm just gonna answer a question on the grant. Somebody is asking, Adrienne is asking how to get the grants. We went to the city, to the state website, and it's actually the car seat distribution program. Just type that in and you'll see all the grants that will cover car seats.
And also I'll add to Adrienne, if you want to reach out to me, I can also connect you to our NHTSA regional office. We do have a base in Atlanta, which I believe is where you're from. And they would be able to connect you with the state contact if you're interested in seeking NHTSA federal grant funds. I can definitely make that connection. Yeah, and Bridgett said, yes, of course, the State Highway Safety Office is a good contact, Safe Kids Worldwide. But I know one of our NHTSA regional offices, Region 4, is located right there in Atlanta. So that might be helpful too.
So I don't mean to, if someone else has a question, I don't mean to
Please.
monopolize,
No, go ahead.
ask all the questions. But I just wanted to share with you something that we're doing. We have scheduled a walk next month with our state representative and our state DOT chair to walk one of our most dangerous streets. A street that has more, it's on the top 10 most dangerous roads in the state of Georgia. We're going to walk it and brainstorm about what can be implemented in the short term to increase pedestrian and bicycle safety on this road. And we're really looking, and we're
That's
just excited
fantastic.
about that.
Yeah, that's great. So that's really hitting on probably some form of a safety walk audit of some sort, but certainly excellent to hear that. And we'd love to hear how it goes. If you
Yeah, so they did a safety audit about maybe 8 years ago, but nothing really came out of it. And so what we're trying to do is take that safety audit and do an actual walk with the state representatives and the policymakers to see so they can see firsthand what it's like to walk on a sidewalk where you have cars going 50, 60 miles an hour right next to the sidewalk.
Yeah, that's great.
Very-
Really excellent work being done. And that's the kind of projects that we'd love to hear about. And that's exactly how community health workers can help us meet that need. So thanks so much, Adrienne, for sharing. Well, I know we're at the top of our time for this session, but just thank you so much. I want to thank my colleagues, Joanna and Bridget, for their presentations and for all of your really excellent questions and comments in the chat. We know it's late in the day, so just really appreciate everything that you've contributed to our presentation, that you've stayed interactive and engaged with us. We will be providing a PDF of the slides, so we'll make sure those get uploaded. But yes, please reach out with our email contact information, and just, yes, thank you for all you're doing in your communities in regards to traffic safety and all of your other program areas and all the other many hats you wear. We appreciate you and we want to recognize you. Thank you.
Thank you, everybody, and happy unity. Nothing about us without us.
Thank you so much. It was good information.
Of course, thank you for being here.
Awesome.
We appreciate every single one of you.
Do we have a survey to do?
I don't believe so.
Our credit for this.
I'm sorry.
How do we get our credit for this? Our CEU for this?
Let me verify that really quick.
Okay.
Hi, so they are not offering CUs for this.
Okay. Okay, thank you.
Of course, thank you.
Thanks, Alexa, for your help.
Thank you, Jamie, of course.
Okay. Thanks, Joanna. I'm gonna sign off. Thanks, everybody.
I'm going to stop the recording.